We should cover type 1 diabetes mellitus as much as possible in this video. You can get basic idea about diabetes mellitus through my previous video. Please watch if you want. Type 1 diabetes mellitus means there is no insulin production in our body. Type 1 diabetes mellitus can be further divided into two. First is type 1a diabetes mellitus, second is type 1b diabetes mellitus. In type 1a diabetes mellitus, it is immune-mediated DM, typically seen in childhood. But a slow-burning variant diabetes mellitus also occurs in later life. It is called as latent autoimmune diabetes in adults. In type 1b diabetes mellitus, it is non-immune-mediated DM. Here a strong hereditary component plays a major role. In overall, type 1 diabetes mellitus characterized by absolute deficiency of insulin, gradual decline of functioning beta cells. Symptoms appear when 80 to 90% beta cells were destroyed, so no further pancreatic response to glucose. Type 1 diabetes mellitus is 10% of all diabetes mellitus. Etiology of type 1 diabetes mellitus. Type 1 diabetes mellitus usually occurs due to immune-mediated reactions. Non-immune-mediated type 1 diabetes cases are rare. There are three main etiological factors predispose type 1 diabetes. First is genetic susceptibility and inheritance. Second is autoimmunity. Third is environmental factors. First factor is genetic susceptibility and inheritance. Increased susceptibility to type 1 diabetes is inherited, but the disease is not genetically predetermined. The identical twin of a patient with type 1 diabetes has 30 to 50% chance of developing diabetes. The HLA genes on chromosome 6 are highly polymorphic and modulate the immune defense system of the body. Individual with HLA types DR3 and DR4 of major histocompatibility complex are most at risk. Second factor is autoimmunity. Type 1 diabetes is associated with other organ-specific immune disease, including thyroid disease, celiac disease, Addison's disease and pernicious anemia. Autopsies of patients who died following a diagnosis of type 1 diabetes show infiltration of pancreatic islets by mononuclear cells. This appearance is known as insulitis. Islet autoantibodies damage and destruct the beta cells. It leads to absolute insulin deficiency. Third is environmental factors. The incidence of childhood type 1 diabetes is rising across Europe at the rate of 2 to 3% each year, suggesting that environmental factors are involved in its pathogenesis. An early enterovirus infection, and early exposure to cow's milk when present concomitantly, boost the immune response to insulin and beta cells. All three factors influence to develop type 1 diabetes. Go through this diagram, you can clearly understand the progress of hyperglycemia. That can lead to type 1 diabetes mellitus. Another most important topic is diabetic ketoacidosis, the main metabolic change. Diabetic ketoacidosis is a hallmark of type 1 diabetes. It is usually seen in the following circumstances. 1. Previously undiagnosed type 1 diabetes. 2. Interruption of insulin therapy. 3. The stress of intercurrent illness. Diabetic ketoacidosis is a diabetic metabolic emergency. It commonly occurs due to omit insulin because the patients feel unable to eat, owing to nausea or vomiting. We should understand the pathogenesis of diabetic ketoacidosis. In the absence of insulin, hepatic glucose production accelerates and glucose uptake reduced. Rising glucose level in blood leads to an osmotic diuresis, loss of fluid and electrolytes, and dehydration. Plasma osmolality increase, and renal perfusion falls. At the same time, lipolysis occurs, leading to increased circulating free fatty acids. There is no glucose uptake by cells, so fatty acids are broken down, and they are converted to ketone bodies. Accumulation of ketone bodies lead to metabolic acidosis, and acidosis can contribute to vomiting. Vomiting further increases the dehydration, and it aggravates the acidosis. You can easily understand the pathogenesis of diabetic ketoacidosis through this diagram. Just have a look. Diabetic ketoacidosis only happens when you don't have enough insulin in your body to process high levels of glucose in the blood. It is less common in people with type 2 diabetes because insulin levels don't usually drop so low. But it may occur in type 2 diabetes also. Think you can get some knowledge about type 1 diabetes mellitus. Stay tuned with us to get more updates. Don't forget to subscribe my channel. Thank you guys.